Carrie from Wrap Your Head Around Silks. This is the Expecting Ariels podcast, now with the Digit Network. How's it going, guys? Thank you so much for tuning in. If you want to check the show notes, lots of stuff going on with Wrap Your Head Around Silks, as always. Roll It Out is every Monday and Thursday, 7 o'clock Pacific. We also have an online platform, so whatever time you can do it, you can access the classes. And then I have my full course. So if you have the problem of going into class randomly and then kind of forgetting some of the basics or skipping them entirely, it is a beginner to intermediate comprehensive silks course where you can basically have access to it forever. It's lifetime access, and you can be taught by me all the basics plus all the bells and whistles too. So that's always there for you on my website. You can access that. Buy it, you have it forever. Aerial rehab is for anybody going post-surgery, post-injury, taking a long break, postpartum, getting back those skills, grip rehab, inversion rehab, knee hook rehab, all the things. And then also coming back from the pregnancy, some specific postpartum stuff. And then what else do I do around here? I do so many things. There's a mini course also for free if you just want to check out my style. All right. Today we have Bethany Shum. She has this amazing, sexy British accent. I love the British accent. Out of all the accents people can have, it's my favorite. She has a business called Flexibility Matters. She works with circus, cheerleaders. She works with people with chronic pain. She is a physio, and she's a bright light. We talk about general hypermobility, shoulder health, chronic pain management, shoulder dislocation, dyskinesia, preventative tips. She's just had an ACL surgery herself, so she's going through her rehab, and she has a new podcast out called Growth Through Movement with a nurse, and they're really talking about this PT and physio to very specific community hours, the cheerleaders, the acro people. So I'm so excited for you guys to listen to this. Let's get started. Beth, I'm sure you hear this from a lot of Americans, but your accent is just so sexy.
Thank you. You're so true.
You're
so English, so British.
So British. I assume, are you born and raised there?
I'm born here, but I lived in Hong Kong when I was little.
Okay.
But I moved here I moved here as a teenager, but I've always been kind of back and forth. So yeah, I think I've adopted my English accent from just living here.
Oh my goodness, I love it. And Hong Kong do you have family there?
Yeah, I've got families here, Hong Kong and Canada.
Oh my goodness. Okay. Beth, please introduce yourself. So a little bit about where you live, your family, your business, and then I'll just jump in.
Yeah, I mean, thank you for having me. I couldn't believe it. I was literally listening to your podcast, and then I'm like, whoa, this is amazing.
It was the universal vibes happening. Your ears were buzzing. You were listening to the Emily Sharp one?
Yeah, I was.
Oh, okay. Awesome. Go ahead. Please introduce yourself.
Yeah, so I'm Beth. I'm a physiotherapist based in the UK, hence the English accent. I work with circus artists in London. I mainly work with the student at the National School of Circus Art. So that's what I do, kind of 2 days a week, and a bit of private work with cheerleaders as well on the side. And then on top of that, I do 2 days in the chronic pain clinic in the National Health Service in the UK. So that's kind of what I do. My specialty is chronic pain, cheer, and circus. That's basically what I see nowadays.
Beth, are you an aerialist as well, or no?
Yes, basically I was an aerialist, but in November last year, I have torn my ACL from gymnastics. So I went into circus as an adult. I used to do cheerleading and gymnastics, and I still do until my injury in November. So now I had to stop completely, unfortunately. I just had surgery in March. So things has been really hectic on my side. I think it will be a little while before I can return to circus, purely from the significance of the injury. Normally, return to sport is about 9 months to a year. So yeah, I missed it so much, not gonna lie.
Okay, so where are you in the recovery process right now?
I'm only 6 weeks in, so I'm just started to walk again
6 weeks. Wait, when was your surgery was
in March.
March. Okay, and had you been needing it for a while, or did you like have an event and then you had it right away?
No, I have an event and I've been I kind of waited for a little bit to see whether I really needed it because I know how long it takes post-op being a physio. I know it takes bloody ages. So I kind of ride it out for a while, did my own rehab. But the main thing is when I do jump and I do a lot of acro, it just gives away.
Yeah, okay.
And that is just not kind of serving me anymore. So then after lots of thoughtful consideration and speaking to like doctors and people, if I want to continue acrobatic mainly, then I needed it. Because I've heard it before when I was 19, but I was able to rehab and carry on. But this time it's just age didn't help it, I guess. 19 is young and you can bounce back, but this time I just couldn't bounce back.
Beth, how old are you now?
27.
27. Still really young.
I know. You have kids and everything. I'm like, your juggle was so much.
I know. I don't know. I feel like the people who have more kids juggle way more. I think I'm okay. This bean is
Amazing.
she's pretty easy. Like we're just stuck at the hip. That's all. We're just together all the time. It's great.
Where are you based in the US?
I'm in LA. I've been here for
Uh,
24 years.
oh my
So
God. LA
so
also have a
used to it.
great circus scene.
You know what? We have a wonderful circus community. We
You do.
have
And even I keep seeing people do acro on the beach, like Acro
yes.
James. He came to London and then I was just jamming and then he was there. I was just like,
Wait, who?
Acro James.
Oh, I don't know who this is, but is he somebody who goes down to the beach every weekend?
I don't know whether he goes every weekend, but he said I certainly saw him training there. And he's kind of really famous in acro.
Oh my goodness. It's an adjacent community, but I know nothing about the acro community here in LA. We have an amazing circus community. What we don't have is amazing circus work
Yeah, well, I mean, I
because
think
there's no contracts. There's
I
like,
feel like that's actually the same internationally, to be honest. Like circus in here is harder than, let's say, ballet or something more traditional with a clear career pathway, that sort of thing.
yeah, we have, the commercial dance world and acting in here. Everything like,
Same.
the
And West End,
filmmaking.
I mean, not for LA, but like in here, there's huge West End shows in London as well.
Okay, yeah. But for sure, as a instructor here, which is what my main job is, it's fantastic because
Mm.
the quality of students is high. I can expect a lot from them. They have high expectations of themselves versus, like, they're very serious hobbyists, I should say. And how
So do
long?
you do workshops on top of regular teachings, like intensive and things? Yeah.
Yeah, when they come around or when, like, I hook up with the studio who wants to bring me in. Yeah, absolutely.
Amazing.
Yeah, but I haven't been traveling so much with my 4-year-old right now. But when
I mean,
she gets older, yeah.
yeah, it's gonna be hard to be like, okay, let's hang. Okay, here's my 4-year-old just gonna like run around.
I mean, I would love her just to be in the space with me all the time, but in like as the age changes, it gets easier and harder. I was gonna ask, how long were you in your aerial practice before you had to take a break?
Gosh, about I think properly I've done it for 3 years before taking a break, but I've been doing it on and off since 21. So that's like 5 years, but like properly training weekly, it's yeah, about 3 years.
So to become a physio, it's a lot of school, right? Like,
Not as much in the UK than people
really?
expect. It's probably one of the fastest route if you want to be the physio in the entire world. Yeah.
Okay,
Because
after you finish you have to finish regular college, I'm
you need
assuming.
to do a 3 year undergrad with 1,000 hour of placement. So within that, you do a thousand hours, and after 3 years, you'll be signed off, and yeah, and then you're qualified. And in the whole world, as far as I'm aware, physio's at least 4 years.
Yeah. So, but 3,000 hours accumulates to what? Like,
1,000 hours. That's about
wait,
six months.
oh,
1,000.
really? Oh my God. In
Yeah.
another life, if I want to become a physio, I'm going to move to London. My goodness,
Yeah.
that's really good.
It's a
Oh,
really hard work though, those
oh
3 years,
yeah.
because essentially you are like working. You will do like 5 to 6 week placement, 5, 6 times. Yeah, about 5 to 6 placement, and it's about 5, 6 weeks each. And then you have to travel because they're never local. It's really hard to get placements. And then you have to do like your dissertation, and oh goodness. I'm just glad like the undergrad's over.
Yeah. So it's a lot of work. It's just compressed.
Yes,
Okay.
exactly.
Okay, so let's talk about how we could help this population. Okay, so let's start with this. What are some things that you see in your practice with aerialists, with cheerleaders, with acro people? What are the injuries that you see commonly, or if there's any interesting stories you have to share?
Well, I actually found sometimes it depends on the age group I treat, because treating students from the National School of Circus Art, it's really different to treating recreational acrobats and recreational circus people. And also treating cheerleaders, you think it's really similar, but actually the sporting demand's a little bit different. So people who do cheer, it's more seasonal. So like in the summer, they'll be fine because there's no competition. But when the season starts, you see a rise of people like asking about treatments or injuries. But I would say the main thing, if you're an aerialist, a lot of things, often aerialist, hand balancer, shoulder is the main issue. But acute injury wise, whether you're acro or aerial, it's ankles and even in cheer. So shoulder and ankles, I think is the most common thing I see. I see some knees as well. That's more, I think, tumbling side of things for people who do tumble, but lots of shoulders. And luckily, shoulder is my favorite joint.
Is it? Tell us why.
Because it's so dynamic. Like the shoulder, it's a board socket joint, and it's just so fun. There's so many variations that you can do with it. Like a knee is a hinge joint. It only goes 2 ways. There's only so much exercise you can do: squat, lunges, and hip thrusts, and bridges. So forwards and backwards. But then shoulder, it's there's so many more range of motion, and then people who do acrobatics and circuits, like shoulders used so differently, and then you can really challenge like how how you hold the shoulder, where the shoulder blade sits, how you engage your rotator cuff, and then there's like so many fun skills and things you can play around with in terms of like shoulder stability, and people who have like dislocation issues as well. So I just find it so much more like clinically challenging and more problem solving. I'm like, okay, can I do this and then what change? And so yeah, it's my favorite. I like treating it.
First question is preventative. How, give us some tips on how aerialists can stay out of injury if they're in a regular practice. Silks, Lyra.
Oh yeah, you call it lyra, we call it hoop, but it's the same thing. Um, I think often when people only train one thing, they don't do the cross training part. So aerialists do a lot of pulling, but they might not train a lot of pushing. And I think doing the opposite can be really helpful for injury prevention perspective. It is quite different if you have a pre-existing injury or a pre-existing condition, because let's say if you are hypermobile or you have rotator cuff issues or AC joint sprain before, then of course you need to strengthen your rotator cuff. So rotator cuff work at end of range are often really helpful.
So
Um,
that breaks down to putting your end of range. Can you be specific for the
through load.
listeners? Yeah.
Yeah. Through end of range through load. Because if you think about like if you do silk or aerial, you put your body through your own body weight, right? So you want to be able to kind of mimic that. Um, but do strength training at end of ranges. And I often find to be fair, like people always ask about injury prevention, but they don't really do it. Like complete I do feel like they don't really do it. And then they come to me when there's issue, and then they're like, oh, okay, I will warm up properly. Okay, now I will get my band out from the bag. And rather than just do like a shoulder stretch, I will do external rotations for 10 times. I will do some lat pull down to get my like lat engaged. Yeah, this is my honest opinion.
I hope that I'm a positive role model because I do a lot of that stuff. You know, they can see me doing. Whether or not they copy or not is the question. Okay, so to really warm up to cross train, the stability work and pushing too, right? So
Yeah.
the push-ups, the planks,
Yes.
all that stuff, the band work.
Yeah, and I think people do it as part of their warm up, to be fair, but not necessarily. Sometimes it's quite hard to have an extra conditioning session on top of
Yes.
aerial. I think that's what making it harder because in warm up you might do like core stuff, you might do planks, long arm, short arm. You might put your hands on wobbly surface because you can even do a plank on a hoop and get your core engaged. It's dynamic, it's moving. But the hard thing is it's just really difficult for sometimes for people to cross train when they love the approaches so much. So if they
Yeah.
just love doing drops and
Yeah. Yeah. And they only
then
have a
and
certain
then
amount
they're
of
like,
time.
what?
Yeah.
You want me to do shoulder press?
Yeah. They only have a certain amount of time to exercise during the week. They have busy lives and they want to
Yeah.
just focus on that one thing. I get it. Okay. A couple other things. Okay. So I have some students who've either dislocated their shoulder in the past and then go back to the practice and now they're nervous, scared about how do they prepare themselves to have stronger, like what's your advice to them?
Yeah, I think it depends. Two things. First of all, like with the dislocation, did they have surgery and had they actually recovered the full range of motion? Because sometimes people will have a full range of motion back, but then they don't feel confident in themselves. And then what I often ask in terms of clinically, it's okay, if out of 10, 10 is the most confident you feel, 0 is like, I'm not confident. Where are you at in that scale? So if they say anything lower than a 7, I would ask, okay, let's find out what is it that's missing. What can we nudge you towards the 7, 8, 9 when you go back to training? I think this is like more like a one-to-one conversation. Maybe it
Yeah.
might be slightly different from like a instructor's perspective because you don't have that time. But I think just having that conversation, it gives you a really clear idea whether it's certain moves. So let's say there's a cheerleader who dislocated a shoulder from what we call an extension move. So that's an overhead, lifting someone overhead. So if it's that move that has the original injury and that is something that you're worried about, let's see whether we can kind of mimic that in terms of strength and conditioning and practicing in a clinical environment perspective. So if you lift a weight over shoulder, how does that feel? If you move one hand out, how does that feel? If you change your grip, how does that feel? And if they feel stable, can we start doing some loading practices, changing what we call like the base of support. So we might get them doing things like holding the weight overhead, but then moving up and down, but keeping the shoulder overhead. So working the core stability, or you can do something differently where you would challenge the weight with like throwing and catching above head exercises and like just feel until you feel kind of that sensation of that your shoulder's been worked or through like a certain amount of time. So that's kind of how I would approach it. But I guess from a teacher perspective, you might have, I'm sure there's other ways to approach it. And I think it depends on that person's self-awareness, especially with shoulder dislocation. If they are kind of very aware and very sensitive, they might be able to tell you when they push themselves towards a certain position, then they might start to feel unstable. And if that's the case, can we just kind of ease, if possible, come off a little bit where they feel kind of that instability and work towards it? I think about breaking it down. That's
Yeah.
kind of what
I
I kind
also
of.
feel like I always am just like, go see a physical therapist because it's like when we're in the silk, when we're doing silks or doing aerial, we're doing the most. You know,
Yeah.
we're doing the most. If your body needs to be working at 25% and you come into aerial, you're not going to be working at 25% because you have to
Yeah.
like support your entire body weight. So people need to I think the number one thing is patience because I mean, you're
Mm.
injured right now. It's really hard to be injured.
Yeah, I think
It's
healing is
hard.
disappointingly slow.
Yeah.
Um, I think that's the main thing that sometimes people think, oh, if it's mild, like a 1 or 2 days fine. But if you have a bigger injury, like a dislocation, it's quite significant. You need to give yourself that time to heal. Like the first, generally, soft tissue healing takes about 6 to 8 weeks. That's just, how long the body takes. So that's already in 2 months in. And then you factor in decondition if you've been training all the time before, and then suddenly you haven't even do a pull up. You can't expect yourself to go back to the same kind of physical condition when you go straight back into training.
Yeah. Being having your instrument not work at 100% is
Mm.
painfully slow for all of us. And even the people who have been injured in the past, you know, when they talk to people who are currently injured, they're like, I know it's hard, just be patient. But us ourselves, when you're in it, it's so hard to be patient. Okay, so
I know it's really hard, isn't it? But I think it comes back
yeah,
to like just being a bit kinder to yourself and thinking about where you want to go. Well, at least that works for me. I'm actually like, well, I know you have a podcast, but my podcast is all about like self-compassion on teaching you how to be a bit more patient when healing. What are the other strategies? Because often that little bit of performance psychology sprinkled on top of physio, like helps a person significantly in terms of that headspace.
yeah, yeah. That psychological piece is such a big part. Maybe
Yeah,
fifty
you can't
percent of it.
separate the physical
Yeah,
and the
yeah. And what's your podcast
psychological.
called?
Grow through movement. We're doing our launch event this Sunday, so watch that
Oh, so
space.
you're just starting it
Just
now?
started. Yeah, we started the recording. So the first season will only be 10 episodes. So it's run by me and a nurse and who's also a yoga teacher. It's because people keep coming and asking us things, mainly in the acrobatic community. And they were like, oh, doctor asked me to stop. I'm like, oh, it's a bit grey.
Yeah, it's gray
You don't have to stop
space.
Afro forever. There are things you can still do. Like, okay, you have an elbow injury from doing handstands, but you can train shoulder and core in the meantime before your elbows get better. And the elbow issue might stems from, your shoulder not being strong enough to support you, and then you overloaded the elbow.
Yeah,
So
yeah.
that's kind of why we started. It's quite the strong why.
Okay, I love this, and that's coming, which is wonderful because I can help put that on the airwaves. Okay, not just shoulders, the entire body, hypermobility, because that happens like I cannot tell you how many
I feel
students come
like
in.
circus people are with hypermobility just naturally attracted to circus
Yeah, because well, also
somehow.
dance too. But for me, it's not really the professionals that give me worry. It's the hobbyists. It's the people that walking in off the street, whether they know if they're hypermobile or not. Some of them don't even realize that they are. I see them in their first stretch. I was like, "Are you hypermobile?" And they're like, "What's that?" So, and then there are people who are hobbyists, but they've been very aware of their hypermobility for a while.
Yeah.
I have one person who just tore her labrum. She had surgery,
Oh,
and it was because the shoulder wasn't
gosh.
stable. It
Yeah.
ripped. So what is any, I know it's hard, it's a podcast, but it's like to give like a general idea. If you could, just for my listeners again, because they've heard this before, but like if you could define it, hypermobility, like how would you know on yourself if you're hypermobile, if there's no one else around to tell you? And then some tips.
Gosh, that is such a big question. I think different clinician will have different answer. I'm going to try and simplify it, but I think hypermobility is a spectrum. So it's not like a black and white condition where you can kind of measure very objectively. There is the Baton score, you might have heard of it before, but we know that it's just measuring joint range of motion. It doesn't necessarily relate to your actual training. So there is another form where you can kind of go through all the other symptoms. And I think at the end of the day, depending on the impact of hypermobility have on you as a person with hypermobility, because some people will have addition like more symptoms than just like a range issue. They might have other things like gut issue, POTS, going to like the EDS spectrum, and they might have flare-ups of pain that moves around. So if you are suspecting you have hypermobile, then I think the best thing to do is get an appointment with a doctor who's made, whether it's a specialist in hypermobility, performance, sports, who can actually give you like an accurate diagnosis and understand the impact of the condition have on your body. And then the next thing is thinking about all the other things that we know what we can work with for hypermobility individuals. So proprioception, we know that people who have hypermobility might have an impact on proprioception. So exercise like yoga and Pilates as an adjunct are great for improving body awareness, joint awareness, and strength as well in those joints. And I think sometimes we forgot or don't remember I think there's a huge value in working slow movement as well, like slow mindful movements, because when we are doing things fast, you'll have muscle memories, your body asks it to do really quickly, and then but if you practice slow movement where you really understand your body, then you might realize, okay, my elbow moves this way. That might be slightly different to another person who hasn't got an hyperextended elbow. My finger joints might be more bendy, and it might get fatigued doing certain things. Okay, can I adapt it? Can I wear like a ring splint or have a kind of special equipment to help protect the joint? And prevent always going to those sublux or hyperextension range. And I think the main thing is like having hypermobility doesn't mean you can't, like, don't let hypermobility define you. Like, you are more than hypermobility, work around it and learn your body. Then you can do the best of what you can do. That's kind of my thought around it. It's long trivial.
Beth, I actually don't know the answer to this. Is hypermobility a fascia thing or a tendon thing or a ligament thing? Or is it bigger than, is it more like from a 10,000, you know what I'm saying? Is it not the specific, or is it like more, oh my God, I'm not asking this question well.
Have you heard of Ehlers-Danlos syndrome?
I haven't.
Yeah. So Ehlers-Danlos syndrome stands for, the short form, it's EDS.
Okay.
So I think what I was just trying to describe is that spectrum. So people will have EDS, which is an actual medical condition. Often takes a long time to diagnose. There's different types, and it's actually a connective tissue disorder. So
Okay.
if you think about connective tissue, what is connective tissue? So it's not just the joints. So you'll be thinking about ligaments, tendon, fascia. They're all connective tissue. So it can affect your skin. It can affect
Okay, so it is
pain.
wider, it is broader. It's
It
not
is
just
broader,
like
yeah.
a fascia
Lots of people
problem.
can have hypermobile joints, but they can be asymptomatic. So they might not have symptoms of what like a medically defined hypermobility disorder or an EDS condition. I think that's when it's quite tricky, because it literally affects the whole body.
Right, gut issues too, that
Generally
makes sense.
speaking, people have hypermobility. Because we get older and stiffer, so they probably have. Sometimes it's the younger generation that might be more prone to certain dislocation, but as they go older, they might be less likely to have kind of recurring.
Your connective tissue is generally looser than someone else who doesn't have hypermobility.
Yes.
Is that all it is? So I've heard also that if you are hypermobile, you're just more prone to hernia, that type of thing.
Yeah, I think you can kind of phrase it that way. So because it's a connective tissue, so someone who's hypermobile, they might have really stretchy skin. Like I don't have that stretchy skin. Like I can't pull my skin away. I know I'm pulling my skin. So, but some people might, like, they can literally pull like the skin away because
Oh,
of
so interesting.
yeah, it's a huge topic. Huge, yeah.
Okay, so that educated me. I didn't know all that. Okay, and the last thing I was going to ask you about shoulders. By the way, I never plan these because like you say something and I'm like, "Oh, this. I want to know about this. I want to know about this."
No, I think this is great
So
because
I've
it
had
tells you where like the where we can meet in the middle as well.
yeah, yeah, because obviously you have a lot of like different clientele and to like really like focus it on the like I know the people that I'm around have these issues. There's a couple people who I've trained who ended up with shoulder dyskinesia, the winging out.
Uh-huh.
And it's still a mystery to me. I know what it's called. And basically, shoulder dyskinesia is shoulder dysfunction, right? That's what the word means. But because I've also seen other practitioners be like, I've never seen this. What is this? People have no idea how to deal with it.
So when you see them, are they have they developed shoulder dyskinesia as an adult, or do they always have it, but not
No,
aware of it?
the people that I've been,
Because it can be slightly different.
yeah, the people that I've talked to, like they develop it out of like a poor training or whatever, or something happens, but they didn't have it before. So they're like, what the fuck is happening with my shoulder? Why do I look like a crazy bird? Yeah. And then I don't know anybody who's born with it, but I'm sure they're out there.
Yeah. So sh for people who doesn't know what that is, basically it's like shoulder winging. So the shoulder, when we talk about shoulder, we don't just talk about your like what we call your humerus, your shoulder bone. You talk about the whole the whole scapular thoracic complex. So scapular, it's like your shoulder blades. Your thoracic is your rib cage, and the movement between the rib cage and your shoulder blade, they need to kind of work together as your shoulder moves. So as your shoulder moves up towards the ceiling, the shoulder blade has to move along it. So in roughly what we're looking at, it's the shoulder blade moving until kind of your axillary line, so like the middle of your core. So for some people who developed kind of an imbalance of shoulder muscle, so if they've been training a lot of aerial, for example, silk, hoop, whatever, they might not be training the muscle that keeps the shoulder blade in. So that can be one factor. So the muscle that keeps the shoulder blade in is called the serratus anterior. So the serratus anterior, it's a muscle that attach from the back of your shoulder blades onto your rib cage. Yeah. So if those muscles are not firing or not activating for a variety of reasons, that can lead to shoulder dyskinesia. And I think when that happens sometimes, because the shoulder blade is kind of winging out, it can reduce the space in the front of the shoulder. So people might be more likely to get like impingement type of pain. So that's one way that people might get it. But the other way that people might get it is actually from a nerve problem. So if they have neck issues,
Ah,
that it's very different treatment approach because if it's a nerve innervates the muscle, so each muscle has nerve root that keeps it working. Your brain goes into your spinal cord, into the muscles. But if you have a problem from the neck, which irritates a nerve root, it can cause shoulder dyskinesia as well. So that is a lot harder to treat yeah, medically as well. So it's really important when you look at the shoulder, you also want to screen the neck, like as people getting neck pain, that doesn't go away. Have they been struggling to move like the neck left to right? And are they getting pain around the shoulder blades area as well? Because yeah, there's kind of I think those two are the main reason why people will get shoulder dyskinesia.
and that's why it can kind of happen out of nowhere, right? Because it's not necessarily that the serratus anterior and the muscles aren't pulling it back into place. It's like a disconnection from the brain.
Yeah. Yeah.
Oh, goodness. This is so interesting.
Yeah, I think the body's fascinating because there's so many ways that the body works, but when it doesn't work, you're like, okay, why is it not working?
Well, if it is a communication problem with the brain, how does one PT that? Is it just doing the exercises and making sure that you're having a mind-body connection when you're doing it?
Yeah, so like treating nerve, first of all, we always create like a problem list to see what is the main problem for that person. Because for one person, main problem might be quite different. So one person might have pain. So if that is an issue, we always address the pain first.
Okay.
But if the person doesn't have pain, let's just say it is just purely from a mind body disconnection, the body doesn't know how to fire it, then you want to find like an exercise that will start activating the shoulder blade properly. And if you find that exercise, so often it will be things like hands on the wall, hands on a ball, doing push-ups, looking at like when you do a push-ups, if you do it, the push-up on the wall, push-up on an incline, push-up on the floor, what is your shoulder blades doing? So you're kind of problem solving to see at which point it's when the mind body disconnection's not working. Okay, if you find that point, you just kind of go underneath it where the body's quite comfortable at that
I
range.
see.
Then you do kind of, well, just basic exercise principles, work on that range, and then progress that range. And I think it's something that you probably need to do. Okay, so this is just broadly speaking. If pain is not a problem, then you need to do it kind of regularly for a few weeks to see whether that's working and whether the serratus muscles is kind of able to keep it back in. So yeah, it's really interesting. It can take a lot of problem solving to find out what's the best exercise for the serratus and for shoulder dyskinesia.
Okay. Oh my goodness, I'm so nerding out on you right now. Okay, Beth. Beth, you have one of your jobs is dealing with chronic pain.
Yeah.
Okay, so let's get into that. What do you see in your practice? What's common?
So what's common in practice? So I have I know, and I haven't met another person that sees such extreme spectrum. So with chronic pain, it's defined as pain that doesn't go away for more than 3 months when they generally have long-term condition. So we see a lot of chronic back pain, chronic neck pain, age-related conditions. We see complex regional pain syndrome, which is, when there's autonomic system dysfunction, dysregulation. And what else do I see? I see a lot of people with fibromyalgia. I see EDS as well, but probably more on like the very disabling kind of population where some people will even struggle to leave the house. So yeah, so I see all that conditions. And for those, it's instead of, because when you have an injury, it gets better, right? So it's way easier to kind of work with the getting better milestones. But when you have a chronic condition that might not go away, you might have things that have flare-ups, then you need to work around management strategies. And we work a lot with psychologists. So we do kind of, there's a kind of treatment method called acceptance commitment therapy, which is basically like helping the clients to work with their values and do a graded approach to rehab. So when I rehab those people, we would do rehab around 6 months to a year and a half. That's how long I see a client. But because the graded approach is so much smaller and slower, it just kind of takes longer. But when people are on board, it's quite transformative in terms of the quality of life and the physical impact and the function as well. So yeah, really different things, but I got quite a lot of the skills is actually quite transferable, surprisingly.
Okay, so if you have the two things that I come across in my population, well, not the neck pain a lot with aerialists and back pain a lot with my general population. So how would you like if you had somebody with either one of those chronic pain, how would you approach it with like exercise? Like what are some tips people can do at home if they have either one of those?
So like chronic pain or chronic shoulder, no, sorry, did you say chronic
Neck
neck pain or
pain
back pain?
and then chronic lower back pain.
Yeah, so this is very generic advice. So this first of all,
Yes.
make sure they know what the condition is first, because different condition have different patterns of the pain. Something more inflammatory, they might get more stiffness in the morning. Yeah. Something that's more kind of activity related, then it might be the length of time. So if you sit for too long, if you stand for too long, activity related, then that can be triggering the pain. Or something that can be more change in exercise load. So if you suddenly go do more workout that impacts your lower back. And yeah, that can also happen sometimes when people suddenly increase the weight too fast too soon. So that can cause pain. But generally, in terms of very basic first line of treatment approach is, knowing your condition. And I found heat really helpful for those type of pain. We also prescribe, ask people to, if it's like a flare up, a TENS machine. So have you heard of a TENS machine before?
Yeah, I have. But explain for
Yeah.
our listeners what that is and how it's
Yeah, so
used.
a TENS machine, it's a device that they have little um kind of black plasticky, what do you, I could call it, tab? No, I don't know what you call it, but they're like plasters, and you stick on certain area of the body, and then you connect to a device where it can transfer like a low grade electric current. So depending on how you adjust the settings, so you can have a setting where you get kind of like a fuzzy feeling. So when your pain's really bad, you can use that. The whole theory behind that is what we call pain gate theory. So when you put those pads on, your body sort of desensitizes the area so you don't notice the pain as acutely. And then the other way you can use it is called the EMS, where you actually stimulate a muscle. So let's say if you're struggling with an elbow pain, no, I know you're talking about back pain, because back pain generally we don't see as much kind of twitch and stimulation, but for elbows you probably do because it's more superficial. But yeah, you can change the setting according to how you want to do it. But essentially, it's another kind of modalities you can use to help manage the pain. And then the other thing you can try, it's like medication. I know I'm not a prescriber, but if it's just a flare up for acute back pain, then actually so sometimes medication for a few days, from like depending on what your medical professional advise you, that can be quite helpful to just let the body calm down for a few days so you can move and do a bit of exercise. Because movement often for back pain, it's really helpful, and also from neck pain perspective as well. So
Are
you'll
you
be
talking
thinking
about
about,
like an anti-inflammatory, like,
yeah, like
okay,
a
Advil or something?
yeah, like what we call ibuprofen.
Yes,
So
yes.
like a non-steroidal anti-inflammatory. But the main thing with back pain is you really want to with medication for just have it for short term, not for long term, because there's so many side effects
Yeah.
for long-term use of medication. And we've been seeing a lot of issues in the UK. I'm sure huge in the US as well, with the use of kind of opioids medication and people getting desensitized with
Because they take it too much.
opioids and yeah, and tramadol. They're taking too much, and the body just stop producing opioids and actually in itself make the pain worse. So my piece of advice around medication generally is only for short term, but it can be really helpful in the short term.
Also pain is caused by so many things. Like,
Yeah, pain is so complex. Yeah.
yeah, complicated. Like, I'm not a doctor. I'm only the what's it called? I'm the expert in my own body, right?
Yeah.
For
And you
me,
probably know your body a lot more than a doctor would have.
yeah, yeah. For me particularly, I'm sure you might be the
Absolutely.
same. But now, not in the past, but now if I get a headache, I know for me that my fascia around my ears are too tight.
Yeah.
And then I release that because I'm a body worker. Like I just do it on myself and it goes away. In the past, maybe that wasn't the reason I was getting a headache because now my aerial practice is so consistent that I'm always having to loosen. I've also learned about my body that, what you were talking about before, this like loose connectivity. I have the opposite. Like I tighten up so easily and so quickly. For me to have a pain-free aerial practice, I need what right now I'm getting is a full 2 hours of foam rolling and ball rolling a week because I teach a class. And
Yeah.
without that, I am in a lot of pre-injury. And that's not the case
Mhm.
for all my friends. I mean, I felt their muscles because I'm a body worker. I'm like, oh, this feels like
Yeah.
water. Like look, like this muscle at rest is like super watery. And then when they flex, it's super hard. Like that's healthy. Mine never gets to that resting place ever. It's just my
Yeah.
body. Everything's different.
Yeah. I think it's really basically everybody's really different, and it's great that you find out what works for your body. Yeah.
Yeah, so
Because
that I'm not loading up on Advil and stuff because I know that that's not really the problem. The problem is, my my fascia's too tight, and that's
yeah.
not the case for everybody. So,
Have you looked into things like hydration and diet?
what are you talking about, Beth? As I slurp water.
As you sip water.
That's
Just
like
I'm
when
just curious, yeah.
that's like when my friends or professionals say the very obvious thing to me. Carrie, have you thought about drinking more water and eating not shitty food? And I'm like, yeah, but that's too difficult. No, I try to drink water, and man, let me tell you, I'm not good at it. Like, I will forget. I will forget. There's some days that I'll really be mindful, but then it's not consistent. So it's definitely something
I
I'm
mean, the
working on.
habit change is really difficult, like especially like the teeniest thing, like drinking water.
Also, water. I drink a higher pH water because it soothes my acid reflux. And that has been
Okay.
a huge change of my life because before that, doctors like, oh, do Tums. Tums is like calcium. Too much of that, like then I'm constipated and then I have other problems. You know what I'm saying? It's just like, so yeah, I guess know yourself. But okay, so chronic
No, but it
pain,
sounds like
Amanda.
you really know yourself, like you like done so many trial and errors. And essentially, like sometimes that's what medical professional does, but we just do it all the time, so we know the right questions to find out the trial and error a bit faster.
Yeah, I mean, I feel like I nerd out with people like you constantly.
It's amazing. I love
And
it.
it's almost like not
You're so
as
relevant in terms of like the people that you talk to. Like it's so relevant to your life.
yes,
Um,
yes.
yeah.
Yeah, I feel like it's almost like a less expensive and a very chill college. Like I'm learning, like I'm getting like a lecture for free, basically. I mean, I'm not getting paid either, right? Paid right now either. But I was just on a couple days ago talking to Jessica Pearson, who is an occupational therapist, and
Yeah.
she just had a tongue tie release on her own body, and she was like on because she's been on before, and she's like, Carrie, I need to tell your audience, she had her tongue tie released, she did the physical therapy, and her neck pain has been released, and
Oh,
it's like
it's all
mind blowing,
it's all
but
connected.
it's all connected. It's totally mind blowing, but it makes tons of sense as well.
You know,
So
speaking
yeah.
of mind-blowing story, I need to tell you this one. There is a guy with back pain in a chronic pain clinic, seen so many doctors, tried injection and everything. And the thing that fixed his back pain, I just still couldn't believe it. It's like he went on holiday and there's a slack line, like a slack line where you like stand on it and like, it wobbles. He was
Uh-huh.
on the slack line for a few days and then
It's
his
gone.
pain gone. It loosened up something in the fascia. That's like that's what we think, and it gives a lot of core stability because sometimes really hard. You know that you need core stability for a back to function, but maybe
Yeah.
that just kicked in his core stability, and everything's firing up again. Then we just on
So
the
like the
slack
brain
line.
body, maybe the brain body connection woke up. Is that what you're
Yeah,
saying? Had he ever done slackline before?
no.
And that's hard to
Like that
start.
story just stayed with me because it's not very common, and I'm like, wow, I'm learning something new every day. It's so true. You learn
Oh,
something new
Beth,
every
and I can tell you're so passionate about it. It's so cool.
day.
Well, because obviously it doesn't matter what your job is, but being passionate about it is like one of the most important
Yeah,
things.
absolutely.
Oh my God.
Because
But
you
that's
spend most of your
slackline.
time working, right? So
Yeah.
you
Yeah.
might as well work in something that you're interested in.
Yeah,
I think
absolutely.
that's
And
why I go into circus because I started to do it as an adult and I'm like, this is so cool. And then people starting to ask me about circus stuff all the time as a physio things related and similarly for cheer. I'm like, why don't I just do that since I love these people? I love that community. I want to
yeah.
give back to the community.
Yeah.
And then that's how it happened about a year and a half ago, and I'm still doing it.
Yeah, and there's some other amazing. I don't know if you saw on my it was a while ago, but Dr. Sue, she's also a circ physio who lives here in LA, and she's in that ballpark as well as Dr. Emily Sherb. But okay, last question for you. So you started your aero practice as an adult, and during and after, like you've already done this education. So how did that aerial practice open your eyes to kind of like understanding what our bodies go through? Like changing the way, how did it change the way you looked at your job and how to
I
help
think
people?
it's I don't know whether this is might be a surprise, but when I was helping people, we talk about graded desensitization. But when I don't have chronic pain, I'm only working, like, I have a help a lot of people with chronic pain with this approach. I know this approach works, but it's really hard to have that first-hand experience until I do circuits. And I started to do, I remember learning about hip hang, or even the first time just holding on to it was so painful. Or like just the hook sound, like the back of my knee hurts. And why do people do that? Or like foot hang was so painful on the skin. And then, but over time, you gradually, yeah, your body get used to it. You stop
Mm-hmm.
getting bruises in certain areas, or like your body develop. Yeah, and you just sort of like get in tune to it, and then after a while, I can't pinpoint when, but you suddenly don't feel. I suddenly certainly didn't feel that pain before, and I think that is just by doing it more frequently and regularly. So I think that's kind of the moment I'm like, graded desensitization does work.
So you're saying that if people do their exercises, it's gonna be okay. Like it's gonna improve, basically,
Yeah.
is your point?
Yeah, and I think also kind of referring to is also the skin sensation, because people can get sensitivity around the scars after surgery or after injuries. So I was just thinking, like, if you do a foot hang, for example, on a hoop, like I remember, like the skin would feel so sensitive and like painful, or even a little bit like inflamed and bruised after. But if you kind of train that kind of consistently and just build up the time you spend on it, and then after a while, you don't feel that pain anymore. That your skin is still your skin, right? So it's just, yeah, your body, how the body perceive that sensation has changed. And maybe there is some changes in terms of like the tissue around it. It may become a bit thicker. You might have a bit more calluses. But yeah, I just thought that was fascinating how the body changed in terms of sensation. Because I don't have an injury as such by training those things, right? I'm not injuring my body, but it's having actual changes still. Does
Yeah.
that make sense?
Yeah, it's fascinating. Beth, I would probably like, oh my God, it's like an hour went by so fast with us, like
Oh
50
my, has
minutes or
it been an
whatever.
hour?
Yeah, it's like 10:03. I'm like, oh my God, this is
Oh
so
my
fast.
God.
Beth, I'll probably have you on again at some point because I have more questions about other parts of the body and everything. We can just, it's like this podcast is like,
It's a great platform because I think you're
yeah.
raising topics that it's actually commonly asked or discussed, and actually not, yeah, we might be able to provide some sort of answers or like thoughts or for other people who
Just
are
raising
dealing
the
with these things.
awareness. Like when we use our bodies like this, we have to kind of know what's going on.
Yeah, I think for the long term as well, like
Yeah.
I do feel like maybe I'm biased, but having body awareness is definitely the more you know your body, it's definitely the best way for it. Definitely.
Yeah, and I'm sure you come across this all the time, and it surprises me because I'm a dancer. We are taught body awareness at a very young age,
Yeah.
and so I have people walking in off the street wanting to do this. They have so little body awareness, little connection, like little brain body connection,
Mm.
and I have to help them build that in a pretty dangerous
Yeah.
exercise, So I feel like that's part of like the me being a teacher, it's not just doing the things like you, and to explain to people why that's important, especially like
Yeah.
with my silk students who are about a year in. I'm like, I'm not going to have you do that dangerous thing, not because I don't think you're capable of doing it once. It's because you don't know where your right leg is and your left leg is and
Yeah.
how high you are. Why do you have to ask me if
Yeah.
you're high enough? You should be able to know that, but you don't because your body awareness hasn't grown to the level of the trick.
Yeah. And I think for people like you said, maybe you come from a dance background, so you're very aware. But when you put people upside down,
Yeah.
sometimes the left and the right, and then you
Yeah.
say put your left hand on the corner of this or grab this circle, and they're like, what? Then you're
Yeah.
like, oh, you need to like just know what you learn. And I think there's a lot of different types of learning. Like some people learn through watching, some people learn through doing. and knowing even what type of learner you are. Are you a watch and do, or are you just a watch, or are you a like watch, sit back, think, sleep on it? And
Yeah, although I'm trying to train my students out of this watch. I'm a air quotes visual learner because it's also a lazy thing. It's a lazy thing because if you ask any dancer to learn something by hearing direction, they can do it because they've already been trained to do it. So it's like a training. I'm such a stickler on this. But yeah, so these are like fascinating things, at least for me. I hope my listeners, I hope you guys are fascinated too. But Beth, what is the name of your podcast again?
it's called Growth Through Movement. We are on Spotify and also on Apple podcasts at the moment. Like I said, the launch is on Sunday. We're so excited. We have, I don't know well, you know, London, but South Wimbledon. People know Wimbledon because of the tennis thing. But we have a hall in South Wimbledon where we are going to do our podcast launch and do a bit of breathwork, yoga, Q&A about injuries, and it's going to be amazing. And yeah, I'm so excited because I think it will add so much value for it's aimed at performing arts and active kind of people who do really active community. So yeah, I'm so excited. Can you tell?
Oh, I can tell, and I'm really excited for you because it's like it's like a personal journey to do a podcast. Like all the steps of it teaches you so much. And then when you guys actually start having guests, I want to jump on.
Oh, please.
100%.
Yes. We're thinking like season 2, there's already people asking.
Yeah.
About it. And yes, and we're also trying to like link in with like charities and kind of just really promote the the community. Yeah. We're thinking about this as like acro and music and performing arts, all those. We love it because me and Mary, the co-hosts we both do acro and we both like perform and stuff. So I mean, I'm not performing now, but maybe
when you get better. Awesome.
When I get better.
Awesome. And Bethany, this is going to be such an easy edit for me because my kid is in preschool, and a lot of times I'm sure you've heard on my podcast, she's right in the back of the.
It's really cute. I love it.
It is.
It actually brings the human out of you. I love it. I think it's great.
I mean, the really positive part that's overriding is that I get to hear her voice develop and her develop over because the podcast has been 4 years already. So like she gets older and that's beautiful. But once in a while, it's nice to not to have to like edit every moment of the audio. So are you also producing the podcast?
Yeah. So
okay, that's a learning curve too.
Yeah. Yeah. Well, I mean, with my company at the moment, it's kind of only like a 3 people thing. So it's quite small. Yeah. So we just jiggle everything ourselves.
Yeah. No, girl, I feel you. It's me. My whole business, everybody's like, if I email you, I'm like, there's no one else checking email. Trust me. I'm a one-woman operation. But it was wonderful to meet you. This is so fun. Let's do this again.
Yeah. Thank you. Thank you for having me. It felt so easy. I love it. It just flows.
Oh my goodness, Beth, I had so much fun talking to you. I really feel like I connect so quickly with people in our community. We just have so much in common, like-minded in so many ways. And I am definitely like in my second, like very chill college experience with this podcast, learning so much about how the body is so connected. I think that's the bottom line. Everything is connected. And the way we can harness the strength of our body to do the things we love to do. It's like the biggest joy. Well, my biggest joy is by being, but such like a way for me to nerd out intellectually, get this intellectual stimuli that, it's like a drug. It's awesome. Like the best type. All right, my friends, please honor me with a 5-star rating and a review. I appreciate you so much. Check out all the stuff on the website, free resources, also things that you can purchase and hold on to and really have these digital resources at your fingertips at all times. All right, my friends, check out Greener Grass, the podcast I do with Kelly McVeigh. We have we have amazing people on, but we have amazing, like badass women on there if you want to ever get inspired. If you're in a slump or anything, sometimes I re-listen to this podcast because these people are so inspiring. Okay, have an amazing week. Over and out. This is Carrick from Wrap Your Heads Around Silks. This is the Expecting Aerialist.